Now I have the pleasure of introducing our first featured speaker, Andrea Walsh. Andrea Walsh is the President and CEO of Minnesota-based HealthPartners, the largest consumer-governed nonprofit healthcare organization in the country. Now, throughout her career, Andrea has been passionate about health and deeply committed to making a difference in people's lives. Today, she leads a team of more than 26,000 people focused on improving health and well-being in partnership with patients, members, and the community. On behalf of the entire Red Cross team, we are incredibly grateful for the tireless work of their frontline workers who are keeping us healthy during this pandemic. Please join me in welcoming Andrea Walsh.
Thank you for joining us virtually for this important event. HealthPartners has proudly partnered with the American Red Cross for more than 20 years, and in these last 2 decades, our drives have been able to collect more than 10,000 units of blood. Our partnership is critical to the work our team does every day. Our lab receives Red Cross blood donations that are used every day to make healing possible and save lives. At Regents Hospital alone, our care team uses more than 14,000 life-saving blood products for an average of almost 40 transfusions a day. And our work doesn't end there. Every day, our team of 26,000 people cares for and supports patients and members, and across our organization, we host multiple blood drives. I'm proud to say we donated 995 units of blood just last year. This is all part of a life-saving journey. From the financial donors that make it possible for the Red Cross to raise funds, to the blood donors that take the time to donate, to our labs and healthcare teams who use blood for patients in need. HealthPartners is proud to be part of this life-saving cycle. And our passion for health and well-being extends beyond blood donations. Let me give you just a few examples. We operate a nationally recognized burn center at Regents Hospital, where we treat many people with burn injuries. And we appreciate the Red Cross Home Fire Prevention Campaign that helps families avoid fires and the injuries caused by fire. Another example is the support provided through the Red Cross Family Assistance Center to provide emotional support. This has been a great service for families who have loved ones in the hospital with COVID. And a final example is our shared passion with the Red Cross to advance health equity and eliminate healthcare disparities. Both the Red Cross and HealthPartners have goals and strategies to ensure diversity, equity, and inclusion, and we're on a quest to recognize bias and put an end to racism. We're actively working to increase diversity and inclusion in our workplaces and with our volunteers, as well as engaging in communities to address the social determinants of health that affect all of us. There's so much more that we need to do, and I see the Red Cross stepping up. The Red Cross has recognized disparities as it relates to sickle cell disease among Black and Latinx communities. Blood transfusions are constantly needed, but specific blood donations are required, usually from someone of the same race or similar ethnicity. The COVID-19 pandemic has exacerbated the problem for those living with this disease, and the need for donations is greater than ever. In the face of these challenges, the Red Cross has stepped up and developed a campaign to share stories designed to educate Black and Latinx community members and encourage donations needed to save lives. This is such important work, building trust with communities of color to improve health and save lives. It's a great example of advancing health equity. At HealthPartners, we've also focused on building trust with communities of color and co-designed communication strategies to improve health. In partnership with the Minnesota State Baptist Convention, we've worked to end the stigma around mental illness for Black people with a Make It Okay campaign. In a similar vein, we've partnered with several diverse organizations to build a Little Moments Count social movement to promote brain development in children 0 to 3 years of age. Trust and relationships with community matter, and both HealthPartners and the Red Cross recognize the importance of partnership to achieve health equity. We're proud to support the Red Cross as it advances work to address health equity and reach communities of color. We appreciate the breadth and depth of the Red Cross programs and services and its reach into community. Our community is healthier and stronger because of the American Red Cross. And we all know that communities are made up of people, and people have stories about the difference the American Red Cross makes in their lives. Let me share one of these stories. It's about a patient at Regents Hospital. Her name is Judaleus. In October of 2018, Judaleus went into labor with her third child. As a Venezuelan immigrant, Judaleus and her husband chose Regents to deliver their baby, knowing that we have an amazing care team that includes interpreter services. Judaleus delivered a healthy baby, but shortly afterwards began to feel sick. She told her interpreter, who translated this to her doctor. Judaleus began to bleed and it did not stop. Her condition was serious. It led to seizures and a stroke. She ended up losing 7 liters of blood, and our doctors were able to use donated blood, platelets, and plasma to keep her alive as she required emergency surgery. Judaleus needed a transfusion of 16 units of blood. Her surgery was successful, and her life was saved. She and her husband now are a healthy family of 5. A happy ending here, and just one of many stories I could share. A story that makes me grateful for our partnership and the work of the American Red Cross. Today, I'm pleased to announce that HealthPartners is expanding our partnership with the American Red Cross and making a financial donation of $100,000 to support the work of the Red Cross as we continue to save lives and end healthcare disparities together. We'll be supporting the new Blood Donor Center and Biomedical Operations Training Facility in St. Paul. We'll be partnering more closely with the Red Cross on the sickle cell anemia program to help make an even bigger impact for those most at risk in our community. I look forward to this work ahead. And today I encourage you to join me in advancing the work of the Red Cross. Your financial contribution is needed. With your help, we can save lives and make a difference in our community. Please join me in making a generous donation to the Red Cross today. Thank you.